Health Hub, we know your health is important, so we have designed this program especially for you. Through interviews with health and wellness professionals and stories of those who have overcome difficult life experiences, we want to bring you the most up-to-date information and current trends on health and wellness. Thank you for joining us today. I'm Joan Warner, and I'm your host. Sometimes our health goes south in what appears to be overnight. Other times we have difficulties periodically or even consistently and cannot get to the bottom line. Have you ever considered it just might be your dental procedures that may have had an impact on your health? Our special guest is Dr. Blanche Grube, and she is here to educate us on dental options. Welcome, Dr. Blanche Grube. I'm so glad to have you here. We've been looking forward to having you here.
Thank you. I'm glad to be here.
And we want to get to know you, so you can give us a little bit of your history as to how you came to dentistry. Where did you start?
Oh, you really want to go back to the beginning?
I do. I want to go back to the beginning.
Okay. Well, then I guess we have to go back to 3rd grade.
Okay.
Because that's where I was first told that I had difficulty reading, and I was placed in a remedial reading class. I never graduated from remedial reading. I was in remedial reading through elementary school, junior high, high school, and then through college. I decided because I couldn't read, I would become a musician.
Okay.
And then I was expected either to become a musician in one of the major orchestras in this country, which is incredibly competitive, or you wind up being a music teacher.
Okay.
Well, so they sent me to student teacher my senior year, and I thought, my Lord, I can't do this. I can't spend the rest of my life teaching these children that there's 4 beats to the measure.
Oh, mercy.
I could not do it, and so I quit college with 96 credits.
Your dad loved that, didn't he?
My dad, he just about had a cow. He was so angry. And he said, well, he says, in that case, you have got to get a job and give me $20 a week, room and board. And I thought, my Lord, $20 a week, that was a lot of money back then. We're talking in the 60s.
Yes, it was.
Late 60s, $20 a week was a lot of money. To make a very long story short, I wound up getting a job as a dental assistant because the ad in the newspaper said no experience necessary. The dentist was a little hesitant in hiring me. He said, well, you have 96 credits, you're probably going to go back to college. And I said, no, I'm probably not going to go back to college. So you can hire me, and I'm a fast learner. All right, show up on Monday looking like a nurse, and I'm going to give you the job. Well, I showed up on Monday looking like a nurse and literally fell in love with dentistry. I thought it was fascinating. I got right in there. I started helping him put the sutures in. It was just like embroidery. I started helping him put the sutures, and he looked at me and he said, you've never done this before? I said, no, this is great. I mean, it's just so interesting. So that was my beginning of my career in dentistry.
Wow.
Another young man who was working with him convinced me that I did not have to know how to read. I didn't have to know how to read to become a dentist. I said, are you sure? He says, yeah. He says, take chemistry. It's H2O, NaCl, sodium chloride, things like that. A lot of memorization. And biology, tons of memorization, but not much reading. I can do that. And so I wound up taking the necessary courses that I needed to do, went back to college. I did another 3 full years as a biology major, got accepted into dental school.
That's amazing.
And I became a dentist.
That's amazing.
I mean, I always say, if God can make a donkey speak, he can take a musician and turn her into a dentist. Absolutely. I'm a perfect example of that. And so I wound up becoming a dentist. I practiced conventional dentistry, meaning that I did all of the things that I was taught to do in dental school. And so I did conventional dentistry for 10 years.
Wow.
I was very good at doing root canals. I was very good at doing full crowns. I could crown somebody's whole mouth, full mouth rehabilitation. I was trained in doing all of that. That was basically my specialty. All right. Then one day a patient came and gave me an article to read about mercury in dentistry. And I thought, what? This article had everything that was the exact opposite of what I was taught in dental school. So I looked at the back of the article, and it had, if you want more information, contact Dr. Hal Huggins in Colorado Springs, Colorado. And so I did call him. I thought I would just ask him to send me a book or just give me some more information. That's all I was looking for. Well, he insisted on me coming out to Colorado Springs to study. And I thought, well, I don't know if I really want to do that. At this point, I've got little children. I have a husband, a dental practice, 2 cats, not necessarily in that order of priority, but they were all a priority.
Right.
Well, he convinced me to come out to Colorado, and I did. And I wound up having a blood test taken the first day I walked in. Now I'm beginning to get nervous because I had never taken a dental course where they actually drew blood from your arm. Well, they drew blood from my arm, and Dr. Huggins spent 3 days talking about mercury. And on the 4th day, he said, well, now your blood tests have come back from Colorado Springs General Hospital, and I'm going to show you, meaning all of the dentists in the class, I'm going to show you how sick you all are.
Oh, well, that's kind of an unusual approach, isn't it?
It is. It is.
And what did you find out from these test results?
What I found out was that I had the beginnings of leukemia.
Oh no.
Yes. And I didn't even understand it at that time.
At what age were you?
Let's see, I was 42 years old.
Oh.
The mother of 3 little children. And I knew I was sick. I knew I didn't feel good. I just didn't know why.
What were your symptoms?
Well, I was always tired.
Mm.
I would get a cold in October, and I would be coughing all the way into March.
Oh, wow.
Not
Yeah.
normal. People would say to me, you still coughing?
Right.
Yeah, I'm still coughing.
Right.
I'll be okay. Well, Dr. Huggins put up my blood test on an overhead projector. Now, people who are really young watching this show, they're not going to know what an overhead projector is,
Right.
but that's what we used to have in the old days.
Right.
So my blood went up on an overhead projector, and Dr. Huggins said, well, whose blood is this? I said, it's mine. He said, well, how long have you had cancer?
Oh, I bet you died. I bet you were mortified.
In a classroom with 60 other dentists? I believe I was the only woman in the class.
Oh, no.
It made it even worse. And I said, well, where do you see that? And he said, well, they circled it in red. Okay. I said, well, it says 1% meta cells. He says, well, you don't know much about leukemia, do you? I said, no, I don't. And he said, well, that's 1% metablastic cells. And I said, well, 1%'s a low number. I'm always trying to be the
Right.
optimist. I said, well, 1%'s a low number. He said, yes. He says, 1% you're sick, 2% you're in the hospital, and 3% you're dead.
Oh. Oh.
That was my introduction to biological dentistry.
I got your attention.
He got my attention. And from that day forward, I would follow Hal Huggins around with a little notepad, writing every little thing he said, writing it down.
So you were his protege.
Yes, I was. Yes, and then years after that, I guess, I don't know, about 5 years after that, I began teaching part of his class until finally I was teaching the whole thing.
Oh, wow.
And so I've been teaching his classes for 15 years now.
And he's been
so,
gone how long now?
He passed away in November
This year?
of 2014.
Didn't he contract MS from his maybe silver fillings or root canals?
Well, most dentists are sick. Most of us contract something. We're working with mercury day in, day out. Some of us in very close quarters. You know, when I first started working as a dental assistant, we didn't even wear gloves.
Oh, wow.
We didn't wear gloves. We didn't wear a face mask. We mixed the mercury with our hands.
Oh, did you really?
Yeah. We squeezed it out with our
No.
hands. Yes. And so we were all mercury toxic. And so it's no wonder that he developed MS. I mean, if you think about the level of toxicity in most dental offices, of course it's not as bad today as it was back then. When you think about the level of toxicity, it's no wonder that dentists have the highest suicide rate,
I read that.
highest divorce rate, and we die the youngest of most professionals.
Really?
Yeah, not a surprise at all.
So they have found that it is a contributor to these things, have they not?
Absolutely. Absolutely.
It might not be the complete thing, but it's
It's never the complete
right.
thing.
There's always something else. So let's fast forward and discuss wisdom teeth,
Okay.
echodermal cells,
Oh, one of my favorite
mesodermal
subjects.
cells.
Because Hal Huggins once made a remark, and he said kind of in passing, he said, you know, I bet it's all about ectodermal tissue in a mesodermal space. Now, most people listening to that would say, what? What did she just say? Well, I have to get a little scientific here and explain to people that when the sperm and the egg first come together and God creates this whole new physical body, that cell divides in half. Everybody knows that. I think everybody knows that. But then the cell divides again, and so now instead of 2 cells, you have 4 cells. Then it divides again, and now you've got 8 cells and 16 and on and on and on, until finally you have a ball of cells. The cells on the outside of that ball are what we call ectodermal, meaning ecto stands for outside,
Right.
dermal meaning skin, ectodermal cells. So these cells that are on the outside of the ball, they become our skin, our hair, our nails, and part of our teeth. Okay? Ectodermal cells. The inside ball cells are mesodermal. They become our heart, our liver, our lungs, our inside organs, all right? Well, somewhere very early in the pregnancy, probably maybe a week into the pregnancy, the outside of the ball begins to pinch in, and that becomes the mouth, and the pinch continues all the way to the other end of the ball, and that becomes the anus. Now, if I had a balloon in my hand, and I could take this balloon and hold it in my hand and put my finger through the balloon without breaking the balloon. If I could put my finger through the balloon, I would ask you a question. Is my finger inside the balloon or outside the balloon? If I was to take my finger and push through a balloon until my finger was at the other end, is my finger inside the balloon or outside?
Well, it looks like it's inside, but it's not really, is
It's
it?
a trick question. It's not really. It's still outside the balloon. So ectodermal tissue that starts in your mouth and ends in your anus is outside the body. So if a child was to swallow a marble, and the marble goes down into their stomach and through their small intestines and through their large intestines, and hopefully 3 or 4 days later, blink, that marble comes out in the toilet, technically that marble never really entered into the body. It just made a pass through
Oh, I see.
from the mouth to the anus.
And why is this so important?
It's important because, like I said before, teeth are half ectodermal. Which half? The crown portion. The part that's in your mouth is ectodermal tissue. The root of the tooth is mesodermal. It's the only place in the body that I know of, and I've studied a lot of embryology. It's the only part of the body that I know of that's actually made up of 2 different types of tissue. God didn't do that anywhere else. But our teeth are ectodermal and mesodermal. The mesodermal part is the root. That part's inside the bone marrow. That's where it's supposed to be. Bone marrow is inside the body. The crown of the tooth is ectodermal. It's supposed to be outside the body. Isn't it interesting?
It is very interesting.
Half outside, a little more than half inside.
And why is this important to know? Why is it so important that you have spent this much time discussing it? There has to be a
You
major point here.
You bet. If somebody has an impacted wisdom tooth, then that impacted tooth is ectodermal tissue in a mesodermal space,
Okay,
right?
right.
Well, the body doesn't like ectodermal tissue inside in a mesodermal space.
It doesn't.
It doesn't. If anybody's ever had an ingrown hair or an ingrown toenail, they know exactly what I'm talking about.
It festers.
It festers and it will swell up, and the body will send fluid. We call that a cyst. The body will send white blood cells. We call that infection. It will do whatever it has to do to get that boil so big until you finally get to the point where you have so much pain, you get brave enough to sterilize a sharp needle
Right.
and pop it. And when you do, all that pus comes out and out comes this black curly hair.
And what does this tell us?
The body does not want ectodermal tissue in a mesodermal space.
And what part of dentistry does that?
Leaving impacted wisdom teeth would do that. Yeah, so you can't leave an impacted tooth that looks like it's never going to come out. If it's lying sideways, it's never going to come out, and it probably could never come out anyway, even if it wanted to. And what the body does is the body is constantly trying to figure out how do I get rid of this ectodermal tissue in the mesodermal space? So if you don't have your impacted wisdom teeth taken out, eventually they become cystic. Just like that curly little black hair. They become cystic and they become a problem, and they can eat up half your jawbone.
Oh, mercy.
And so that's why it's always a good idea to take out impacted wisdom teeth.
Can you leave other wisdom teeth in that are not impacted?
Yes, if they look like they're going to erupt one of these days, you can leave them in. But if you're 45, 50 years old, chances are they're not going to come in. You really should have them taken out.
Okay.
Okay? And the longer it stays in that position, the longer it becomes a problem for the body.
And when they take these impacted teeth out, or non-impacted teeth out, when they take it out, there's a root, correct?
Absolutely.
And that root is extensive. I mean, I know when I go out in the backyard and I pull out my weeds,
Right.
I mean, it takes me forever to get to the root.
Right.
Is it the same in dentistry?
Yes, it is.
Okay.
It's very important that not only the root come out, but all of the root come out.
Is this a
All
quick
of it.
procedure? I mean, could this be done
Yes.
quickly?
Only if the dentist gets lucky.
Okay.
If the dentist gets lucky, it can be quick. But usually it's not. Taking out impacted wisdom teeth takes time and a lot of care. It's in a very delicate part of the body.
Well, how would you know if the dentist actually got all the roots?
An x-ray.
An x-ray. Okay.
Sure, an x-ray would show. And there are actually some dentists will take an x-ray during the surgical procedure to see if they've gotten it all
Well,
out.
that's good to know.
And especially if they heard a little snap while they were taking the tooth out.
I see.
So it's very important, if a dentist leaves part of the root, then that root is dead tissue. It dies. And so then it's very much like having a dead part of the body still there.
Right. So, Dr. Grube, why are there so many people walking around whose sockets don't ever seem to heal and they have constant problems out of it?
That's a very good question. And I think what you're alluding to is the word cavitations. And there are a lot of people who are now becoming aware of cavitations. And for our audience, I'll let them know that a cavity is a hole in your tooth. And where there's decay, everybody knows that. A cavitation is a hole in your jawbone, usually where a tooth was taken out and it never healed properly. Now, just as I was saying before, it's important for the dentist to take out all of the root. It's also very important for the dentist to make sure that he or she does not use a chemical called epinephrine. Epinephrine is actually a chemical that our body produces naturally. It's what makes a woman be able to pick up a car if her son was trapped underneath
really?
it. It's your flight or fight hormone.
I see.
If you see a lion and you've got to run, it's the epinephrine that's being secreted by your adrenal glands that makes your heart beat faster, makes your blood vessels contract, and you can do astounding things that you normally could not do if you weren't scared out of your wits, okay? So epinephrine is a very natural substance produced by our body, but it's also produced synthetically, and it's placed inside all of the different novocaines. Now, I'm using the word novocaine because that's what most people understand. And that's why a lot of people say, you know, I went to the dentist, gave me a shot of Novocaine, and my heart started beating. Boom, 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 boom. It's from the epinephrine. So when a dentist takes a tooth out, if they give you Novocaine with epinephrine, that causes the blood vessels in the body to contract, right? That's what epinephrine does. And so for the dentist, that's a good thing. The patient will stay numb for a long time. There'll be very little bleeding. This is all good things for the surgical procedure. The problem with the patient is that when the blood vessels contract, the very, very smallest of the blood vessels, which are called the capillaries, those are the ones that carry the red blood cells with oxygen to the bone cells. When a capillary contracts, you have a problem. The red blood cells can't get through that capillary. And those poor little bone cells that are waiting for oxygen don't get it. And so they die.
Oh.
So when a tooth is taken out, if the dentist uses epinephrine, you wind up creating a lot of dead bone cells.
So what is an alternative?
Just tell the dentist, I do not want any epinephrine in my Novocaine.
That's amazing. That's a real
You
good
will
tip.
bleed a little bit more, but the bleeding is actually a good thing. It really is. It's God's way of having our body cleanse itself. when something is bad, you bleed and you flush out the bacteria with it. So a little bit of extra bleeding is actually a good thing.
Okay.
If the dentist does give you Novocaine with epinephrine, and you have some dead bone cells, then part of the socket is going to heal, but not all of it. And it stays a hole in the bone.
Is there anything you can do about that ever?
Yes. Most people are not too happy to hear this news, but there is a cure, and unfortunately the cure involves surgery. You have to cut the gums, go back into the hole without epinephrine, let it bleed, rotor-rooter it, clean it all out, let it bleed. Eventually, in 20 minutes, the bleeding does stop, and now your body can take that blood clot and turn it into your bone.
Oh, really?
It is the best thing in the whole world.
That's amazing.
To making Joan bone is Joan blood.
Wow.
It is the best thing in the whole world. There's nothing better than Joan blood for making Joan bone. And there are some dentists who will try to encourage their patients to put in hydroxyapatite crystals, that's artificial bone, or worse, cadaver bone.
That's worse?
That's worse. Okay, you're actually taking the dead bone from a body with their protein molecules, their memory, their everything, and putting it into your body. And so they tell you that it's sterile, but it's actually impossible to completely sterilize cadaver anything. I once had an instructor in the many thousands of continuing education courses that I've taken. I once had an instructor ask the question, where is the memory of the body? And almost everyone in the class said, well, the memory is in your brain. And he said, no, your memory of your life is in every single cell of your body.
Well, that would make sense, wouldn't it?
Yeah.
Well, let's move forward and go to cavitations, as far as who would take the time to clean up these cavitations the way they should be. Is this like a conventional dentist, or is it an alternative dentist, or is it a combination of both, a holistic dentist?
Mostly dentists who were trained, and so these would be what we call biological dentists.
Biological dentists.
Right. So very few conventional dentists even can even recognize a cavitation on an x-ray. If they haven't been trained to see it and to know what they're looking for, they don't see it.
And so how would you ask them for their credentials on that?
You just ask them if they have had training in cavitation surgery.
Okay.
And of course, the organization that I'm very active in, which is in the International Academy of Biological Dentistry and Medicine, IABDM, we go out of our way to train dentists to do cavitation surgery. So if somebody wanted to look for a dentist who does that, they could go to that organization.
So there are many dentists that will.
Oh, absolutely. Oh, yeah, I know, because I've trained many dentists.
Really? So you would say that would be hundreds or thousands
Probably
of dentists?
hundreds.
Well, that's good to know. So they're there.
Oh, yes,
they're
they're
for the
there.
pickings. Okay.
And so if somebody has a problem and their physician just can't seem to figure out what the problem is, it could very well be that they have a cavitation that has been brewing for 30 to 40 years in their jawbone. And you know, most people don't get really sick or get any symptoms until it's been 30 or 40 years. If you develop a cavitation when you're 19 years old and you just had your wisdom teeth taken out, you don't develop any symptoms from that cavitation until you're in your 40s and 50s.
And those symptoms would be what?
Oh, it can be anything from chronic headache to irritable bowel to a heart attack to a stroke to cancer.
And those are some serious.
We have research to show that the microorganisms that are inside these cavitations cause those kind of diseases.
So, Dr. Grube, you say it takes years for cavitations to become a problem. Is it the same way with root canals?
Yes, it is. Yes, it is. When a dentist first does a root canal, actually, why do dentists do root canals? They do root canals because the pulp of the tooth, the center of the tooth where the nerve and blood vessels are, is infected. So they do a root canal by drilling a hole through the middle of the tooth and removing that main trunk or that main canal. that has blood vessels, it has a little bit of lymph, it has red blood cells, and it has lots and lots of nerve tissue. Anybody who's ever had a root canal can tell you that there's lots of nerve tissue in there. When a dentist does a root canal, they remove that middle portion. The dentist can't do a thing about cleaning out all the lateral blood vessels, nerves, and fibers that come off that main branch. So it's very much like, I just said the word branch, it's very much like a tree.
Right.
When you look at a tree, you have the trunk of a tree, but you also have branches, you have twigs, and you have leaves. So there's this huge community of conversation of nutrients traveling from the trunk of the tree all the way out to the teeniest little branch at the top of the tree. It's the same way with a tooth. The tooth has the main canal, but it has millions and millions of little teeny lateral canals that come all the way to the outside of the tooth. So when the dentist does a root canal, they drill a hole in the middle, they clean out the main branch, the main trunk of the tree, if you will.
Right.
Can't do anything about the little lateral side ones. Well, it takes years for those to die down. And then as they die down, they become infected. And as the bacteria inside the root canal tooth increase, then they become a problem. So the older the root canal is, if it's a root canal that's been in your mouth for 20, 30 years, that root canal is much more toxic than a root canal that's brand new.
Oh. Well, is there an alternative way to deal with this?
No.
Another option?
There is no way to keep something that is dead alive.
So what other options would you have if you don't do a root canal? If you chose not to do a root canal, what other option could you?
If you choose not to do a root canal, you're much better off extracting the dead tooth, get rid of the necrotic tissue, and then let the socket heal. Once the socket heals, it can be replaced with a bridge or a partial denture.
Well, this was an amazing interview. I appreciate you coming out.
Thank
and
you.
we definitely have to have part two.
Thank you.
You coming
Yeah,
in?
part 2, 3, 4,
That's
and
right.
5.
Again, we want to thank you for joining us today at Health Hope. I hope you've enjoyed your time you've spent with us. You can learn more about us on Facebook, Health Hope TV. And remember, health is the goal and hope is the anchor. We'll see you next time.